And I feel like this year, when I was listening to speak at the Academy meeting, that you had a scale or a mnemonic or like a list of like things that you're looking for on endoscopy. Can you tell us about that?
Yeah, I have I call it a MELO assessment. So that's the mucosa. Sorry, is there a lot of mucus? Is there erythema, edema, lymphoid hyperplasia? And then finally, what's the quality of the opening? So that's excess mucus, edema, erythema, lymphoid hyperplasia, adenoid-like tissue penetrating into the lumen or robust around the orifice, and then that opening. So those are the bullet points that I'm specifically looking for on the endoscopy exam.
And then are you grading them on like with a number scale or like a mild, moderate, severe? Or how do you use that in your treatment algorithm?
So that's exactly what we do. Yeah, there is now a validated scale that one of my fellows put together, Kivikas, and it is normal, mild, moderate, severe, 1 through 4. Mild is just some mild edema. The vessels are a little indistinct, but there's no compromise of the opening. Moderate, there's inflammatory disease. There is compromise of the opening. And then severe, it never opens. So it's a rough qualitative scale, but it really does help in determining how severe is the problem and how aggressive do we need to be with treatment.
And so your score is like an overall score for all 4 categories. It's not like you would have a 1 under the mucus and a 4 under the, opening. It's kind of like overall, this is the score. Is that right?
Yes, we originally published something that was more complicated, like you said. We were scaling every factor. Nobody used it. Too complicated.
Too
So
much.
this is a combined inflammatory quality of opening rough number.
Gotcha. And in looking at the eustachian tube, you also talk a lot about that kind of band of mucosal edema that is common in your obstructive patients. Can you talk more about that?
So when you look at the eustachian tube, there commonly is a little redundant band that runs along the floor in the cartilaginous wall. So that's quite normal. But it very early on can become edematous, and it will have this pale edema that can bulge into the lumen. If that becomes significant, that is the most common finding you'll see with the baro challenge patients. Now, when you have more severe obstructive dysfunction, that band can just blend in with the rest of the edema. But that's why I pay attention to that band. It's the most common thing you'll see in the patients who are only baro challenged.
Mm-hmm.
But again, the band is normal, but then you'll see that it's not protruding significantly into the lumen. It's not a problem.